There is an epidemic of low thyroid in our country. The struggle to diagnose and the lack of a cure is more prevalent than ever, but there are ways to treat hypothyroidism. Here to talk about the functional ways to do just that is Dr. J.B. Saleeby, Medical Director for Carolina Holistic Medicine. Dr. Saleeby, thank you for joining us.
Oh, it's always a pleasure.
Always a pleasure for us as well. And now, what is hypothyroidism, if you can give us a brief overview?
Well, briefly, hypothyroidism is low-functioning thyroid. Okay. Either your gland sort of dries up or it's partially been removed, or some toxin affects it where it doesn't function properly.
And now, why is the thyroid so important? What does it do for us?
Well, the thyroid and its hormones are the master hormones of metabolism. Okay. So if the thyroid is not up to par, everything kind of slows down from, brain function to heart function, things like constipation, hair loss, some of the symptoms that you see.
It affects everything.
It does.
And now, in order to treat, you have to diagnose. So how would you go about diagnosing a patient with that?
Well, traditionally, most doctors run a TSH and a T4. Okay. But really, to get a better picture of what's going on, you need much more than that. Free unbound T3, unbound T4, thyroid peroxidase, antibody titers, and something called reverse T3 are imperative to get a good picture. Most of the hormones that come out of the thyroid gland are T4, about 80%. Okay. 20% is T3 that comes out. But really it's important for the body to be able to manipulate how much conversion needs to occur. So that's done in the peripheral tissue. Okay. So it comes out of the gland, goes through the bloodstream, goes to the muscles, the bones, the liver, the kidney, and then an iodine atom is popped off and you go from T4 to T3. Okay. And that's the active hormone.
And something we were talking about earlier, so a way to diagnose, you mentioned Wilson's protocol. Can you tap into that a little bit?
Yeah, so Dr. E. Dennis Wilson, he was a doctor that specializes in hormone therapy, and he devised a program. Instead of using blood, he uses basal body temperature measurements. Okay. So 3 hours after you wake up, you stick a thermometer under your tongue and you plot that number. And if your temperatures run low, you're very likely hypothyroid. If they run high, you're hyperthyroid.
Oh, okay. And so what are some treatments that you would give your patients?
So first of all, we do a full analysis of the blood work, also check things like iron, magnesium, iodine, and selenium. And there are some genetic things that can also impact the thyroid. Once we've made a determination if it's just the thyroid gland or it might be their adrenal glands or some other problem, and we just definitely want to make sure it's not hyperthyroid, then we can treat them. If they have low functioning thyroid, we can try to correct it with some herbals and nutritional medicine. If that doesn't work, there are some natural things we can prescribe.
Okay, and so the treatments aren't one size fits all, it kind of varies per patient.
Right, exactly. So one size fits all is kind of mainstream. They kind of prescribe one dose or one type of thyroid medication, levothyroxine or Synthroid or Terracint, which is T4 only. And to be honest, only about 10% of women will respond to that. 90%, it's not the right one. So we use a combinations of T3, T4, things like Armour thyroid, your audience may recognize that, or we use compounded T3 only, sustained release. I mean, so there's lots to do.
Okay. And now as far as symptoms go, from my knowledge, it's a lot of things that can fall into other illnesses like fatigue, and I feel like we're all tired. Are there any key symptoms that you look for when you're diagnosing a patient?
Yeah, so brain fog and low function, fatigue, sleepiness, low libido, loss of hair, specifically the lateral parts of the eyebrows will thin when a female especially has hypothyroidism. But you're right, there is some overlap, especially with some of the viruses out these days, Epstein-Barr and things like that.
And now what lifestyle changes would you recommend for someone who is struggling with hypothyroidism?
Yeah, well in the United States, one of the key causes of hypothyroidism is Hashimoto's, which is an autoimmune disease. And it appears that people are very sensitive to gluten. They're either celiacs or gluten sensitive. That makes that worse. So avoiding gluten in the diet might be one of the first easy steps to do to limit that problem.
So if anyone is, possibly thinking that they may be having thyroid issues, where can they go? Where can they find you for more information?
So yeah, CarolinaHolisticMedicine.com, and we specialize in thyroid disorders.
Wonderful. Well, Dr. Saleeby, it's always a pleasure. Thank you for joining us today.
Yeah, glad to be here.
Absolutely. We're back in 2 minutes.